Aase syndrome is a rare genetic disorder that primarily affects the development of the bone marrow, which is responsible for producing blood cells. It affects red blood cells and bones, leading to a variety of symptoms and complications. Individuals with this condition experience anemia, a state where the body lacks enough healthy red blood cells to carry adequate oxygen to tissues. Anemia means the body doesn't have enough healthy red blood cells, which can result in a range of symptoms. This leads to fatigue and weakness, making everyday activities more challenging for those affected. Another key feature of Aase syndrome is skeletal abnormalities, which can vary in severity. This can include underdeveloped thumbs or forearms, which may impact the individual's ability to perform certain tasks. Aase syndrome is present at birth, and early signs can often be detected in newborns. It is a challenging condition for both the patients and their families, requiring ongoing medical care and support. However, with proper management, individuals with Aase syndrome can live fulfilling lives, participating in many of the same activities as their peers. Early diagnosis and intervention are crucial in managing the symptoms and improving outcomes for patients. This helps improve quality of life for patients, allowing them to thrive despite the challenges posed by the condition. Aase syndrome is very rare. The exact cause is not fully understood. We know it's caused by genetic mutations. These mutations affect the production of ribosomes. Ribosomes are essential for protein synthesis in cells. The specific genes involved are not always clear. Research suggests it might be inherited, but most cases appear randomly. This means it's a new mutation in the family. More research is needed to fully understand the genetic basis of Aase syndrome. This will help in developing better diagnostic and treatment strategies. There is no cure for Aase syndrome. Treatment focuses on managing the symptoms. Blood transfusions are common. They help address the anemia. This helps improve energy levels and overall health. Surgeries may be needed. This can correct skeletal abnormalities. Physical and occupational therapy are important. They can help improve mobility and function. Treatment is individualized. It depends on the specific symptoms and severity. A multidisciplinary approach is essential. This involves hematologists, orthopedists, and other specialists. Section 4, the science behind Aase syndrome, delving into genetics. In this section we will explore the genetic underpinnings of Aase syndrome, a rare disorder that affects multiple systems in the body. Understanding the genetic mutations that cause this syndrome is crucial for developing effective treatments. Aase syndrome results from mutations in specific genes that are essential for normal cellular function. These genetic changes disrupt the normal processes within cells, leading to the symptoms observed in patients. These mutations affect ribosome biogenesis, which is the process by which ribosomes are produced within the cell. Ribosomes are complex molecular machines that play a critical role in translating genetic information into proteins. Ribosomes are responsible for protein synthesis, a fundamental process that is essential for the growth, repair, and maintenance of all cells in the body. Without properly functioning ribosomes, cells cannot produce the proteins they need to survive and function. This process is crucial for cell growth and function. When ribosome biogenesis is impaired, it can lead to a wide range of cellular dysfunctions which manifest as the various symptoms of Aase syndrome. In Aase syndrome, ribosome production is impaired due to these genetic mutations. This impairment has a cascading effect on the body's ability to produce red blood cells and other essential cellular components. This leads to a shortage of red blood cells, a condition known as anemia. Anemia can cause fatigue, weakness, and other health issues, significantly impacting the quality of life for those affected. It also affects bone development, leading to skeletal abnormalities. These abnormalities can result in physical deformities and other complications that require medical intervention. The exact mechanism linking these mutations to the specific symptoms is still being studied. Researchers are working tirelessly to uncover the detailed pathways and interactions involved. Researchers are working to identify the genes involved and understand how these genetic changes lead to the clinical manifestations of Aase syndrome. This knowledge is essential for developing targeted therapies. Understanding the genetic basis of Aase syndrome is crucial. It provides a foundation for developing diagnostic tools, treatment strategies, and potentially even preventive measures. This will pave the way for potential gene therapies in the future. By correcting the underlying genetic defects, Gene therapy holds the promise of not only treating but potentially curing Aase syndrome, offering hope to patients and their families. Section 5. Hope on the Horizon: Research and Future Advancements. While Aase syndrome presents significant challenges, there is hope. Researchers around the world are dedicating their efforts to uncovering the mysteries of this rare genetic disorder. Their work is not just about understanding the condition, but also about finding ways to improve the lives of those affected by it. Research continues to enhance our understanding of this complex disorder. Every day, scientists are making strides in identifying the genetic mutations that cause Aase syndrome. These discoveries are crucial as they lay the foundation for developing new treatments and therapies. Scientists are actively investigating the genetic underpinnings. This research is crucial. By understanding the genetic basis of Aase syndrome, researchers can develop more effective diagnostic tools and therapeutic strategies. This could potentially transform the way the disorder is managed. It could lead to earlier diagnosis and more targeted therapies. Early diagnosis is key to managing Aase syndrome effectively. With targeted therapies, patients can receive treatments that are specifically designed to address their unique genetic makeup. The development of gene therapies holds promise for the future. Gene therapy has the potential to correct the genetic defects that cause Aase syndrome, offering a long-term solution rather than just managing symptoms. Advances in genetic testing also offer hope for families. These advancements mean that families can receive more accurate information about their genetic risks, allowing them to make informed decisions about their health and future. This allows for better risk assessment and family planning. Families can plan for the future with greater confidence, knowing that they have the information they need to make the best choices for their loved ones. With continued research and advancements, the outlook for individuals with Aase syndrome continues to improve. The dedication and hard work of researchers and medical professionals are paving the way for a brighter future for those affected by this condition.